crab girl. We don't see this as often because everyone does ultrasounds now, but let me just take a moment to explain this a little bit, all right? Our legs don't bend like that, obviously. They may, and this is where if you understand how normal stuff works, then figure out, well, geez, where do things go wrong? That's what's going on over here. I'll explain to you that our feet twist in our mother's womb. When we were, I guess, about 5 or 8 weeks of gestation, our legs actually were like this, but then they flipped around. Now, I'll prove to you 2 ways, and I'm not going to argue about that with God or whoever made us this way, because it actually works out, and I'll explain why. What's the purpose of our legs flipping around? First of all, let me prove to you. If I take my arms like this, my forearms, if I bend them, if I flex them, are they going into the audience or away from the audience? Into the audience, right? If I bend my lower legs at the knee, are they going into the audience or away? Away. Something happened, right? I mean, if you take the upper limb and lower limb, there's a lot of similarities. There's 1 bone, 2 bones, many bones. 1 bone, 2 bones, many bones. Why did our legs flip around? The other thing is, if you look in the anatomical position, our thumbs are lateral, right? The corresponding toe that goes with our thumbs is the great toe. And the great toe, is that lateral or medial? Medial. Something happened, right? So, why did this all happen? Well, it's because we walk upright. Us walking like this and doing things with our hands. I know now everyone likes to, text and walk at the same time. I don't encourage that. There's a car could be coming and, well, we'll eliminate those people. But the thing is, that allows you to do things with your hands and yet walk. That's what makes us more advanced than other species. All right? Gorillas, well, they knuckle walk. They could get up and go like this, but they have to go right back down. Monkeys do the same thing. So this makes us a little bit more advanced than them, walking upright. So how do you explain that? Well, why do our legs do that? When I walk, we need to make sure that our torso is perpendicular with the floor, right? We can't, the center of gravity has to be that way. I can't be leaning this way or that way. It has to be perpendicular. So that allows me to walk upright. If I take 1 step, I'm going to exaggerate so you can see this. If I take 1 step forward, my back leg is doing what at the knee? Bending. It has to bend. If I don't bend, then my center of gravity is going to be different. If I exaggerate it and bend it forward, have my knees like I'm walking like this or a flamingo, now my center of gravity has to be in front here, and I can't do things with my hands. Does that make sense? You've got to be upright like this. And that's why our legs bend, flipped around to do this. All right? So we don't see this. This is like probably the 1800s or whatever, early 1900s, before ultrasounds, that we could actually see what's going on inside the mother's womb. And then you have to make amends or whatever they have to do. Okay? So that's what that's all about. Now, with that said, this is going to be different. Your first 5 chapters of pathology was just general pathology. All right? Necrosis and different types of necrosis, even reviewing immunology and doing some infectious disease. Those first 5 chapters were just, it's general. I don't say just. You need to know that to deal with all the different diseases we're going to be talking about. But now we're going into systems. I think, and I feel, that it's going to be easier. Not easy, but easier. Because we're going to be, again, using more of the A and P, but we're really using a lot of the normal stuff. Before that, a lot of that was new stuff, unless it was immunology or microbiology. But a lot of it was new. This, what you're going to have to do, and what I like about this book that I chose, the first few pages, it might be anywhere from like 2 pages to 7 pages, depending on how big it is. I think nervous system, I think it's like the first 7 or 8 pages, is all review about A and P. It's normal stuff. So my suggestion is read that on there. It's going to give you a big overview of the stuff that you need to know for what we're going to deal with in terms of pathophysiology. All right? If you're lost with any of that stuff because they just give you an overview of it, then utilize the tutoring. Come to me. Look in your, into your book. Look at YouTube. Whatever. Look in your A&P book. Because that's the stuff you got to come into, and I'll be dealing with the diseases. Now, if there's stuff in there, if there's certain things that are not in your book, I'll try and cover a little bit for you, especially if it's going to be dealing with the diseases that we're talking about. So what I'm going to do here is, for this time only, I'm going to put up some review stuff. And I'm going to review for you some key things that you need to know before we get into these diseases. All right, it'll be basic stuff, some with the regulation of calcium, what happens with osteoclasts and osteoblasts. And this is key stuff, So I'm going to kind of go fairly fast with it, but if you're lost with this stuff, then you know what you got to do to review it. All right? But if you understand what osteoblasts do, then what happens if you have too much of it? It's going to cause a disease. If you know what osteoclasts do, if you have too much of it, that's a disease. So you need to know the normal stuff. I'm going to try and briefly review that with you. Okay? All right. So, all right, here we go. So some highlights of normal bone and joints. Now, I'm going to just do this part here, go into some diseases, stop, and then I'll do that little review thing I was going to do with you, test taking strategy. And then we'll do the rest of joint disorders and normal muscle stuff and muscle diseases on Wednesday. So that's basically how I'm breaking that up. All right, so these are general features of bones. All right, I'm going to do some art therapy up here. So you should know these words: diaphysis, epiphyses, metaphyses. So you have here a bone. And you know we don't have any bones in our body. It looks like this. This is just a typical run-of-the-mill doggy bone, right? We have over here the ends of the bones. These are going to be the epiphyses. The shaft of the bone is going to be your diaphysis. Okay? The area in between the diaphysis and epiphyses are the metaphyses. And in the metaphyses, well, that's where the epiphyseal plate is. That's where the growth plate is. So let's draw it a little bit bigger so you can see what's going on. Okay. Over here, we're going to have hyaline cartilage. And in the hyaline cartilage, you will have chondrocytes. Okay? Now, this is where we have the growth plate. What will happen here, these are chondrocytes. One cell will go through mitosis, and it's going to make two cells. One that goes up, and one is going to replenish that cell that just went through mitosis. Does that make sense? So one is going to replace that one, and one is going to be put out in the front. Then this one will do the same thing too. It'll go through this, and one will be replaced, and so forth. You got to imagine what's happening here is that this epiphyses, the ends are going to move that way, right? That's what bone growth is. All right. So the epiphyseal plate, all right, or growth plate, that's what we're going to have with bone growth going, or long bones. They're going to grow lengthwise. That stops at about 21 years old, and it's not going to go through mitosis anymore. Now what we say, instead of it becomes an epiphyseal line, and we say that the epiphyseal plate fused, and it means that there's no more growth going on, at least lengthwise. Okay, is that clear? All right. Then we have inside here, it's hollow, and inside there you will have bone marrow. The bone marrow could either be yellow bone marrow or red bone marrow. If it's red bone marrow, then that's going to be making all the red blood cells and white blood cells and platelets. If it's yellow bone marrow, then that's going to be fat, adipose tissue. So and that happens in an adult, that the long bones are all yellow bone marrow. And in children, the long bones have red bone marrow. So if an adult fractures a long bone, a femur or whatever, there's a great chance that there could be a fat goblet or a fat droplet going into the bloodstream and going into the lungs. It now is a fat embolus. So when you think that someone had a, they had a motor vehicle accident, or let's say they're better. They had they're playing baseball, right? 22-year-old playing baseball. He breaks his arm because he fell down, and now he can't breathe. One of the things you should be thinking about, an embolus from the broken fracture. Okay? So let me just show you some pictures of this stuff. All right? So there's our bone, right? Diaphysis, there's the two epiphyses, all right? There's the epiphyseal line, and it's a line when it's all fused. It's hollow inside. You'll have the yellow bone marrow if it's an adult. You'll have red bone marrow if it's a child. Okay? And you also see a close-up of all that wonderful aversion systems and all that stuff. All right? We've got to talk about the cells in here. Oh, one other thing. Compact bone and spongy bone. Compact bone is going to be this area here that will only be on the diaphysis and part of the metaphyses. Okay? Spongy bone will always be in the end bones, the epiphyses, and around the medullary cavity, which is the hollow area there. Spongy bone is the closest thing I could explain what that is. You ladies will know better than some of the guys here, but it looks like a loofah. All the girls are like, yeah. The guys are like, It's that, I don't know, that log, that beige log that's usually, if you live with your sister or girlfriend or mother, it's usually that long, spongy thing that looks like it came from the ocean, right? But that's what it is, it looks like a sponge, right? That's what a loofah is. And they use it on their skin to make their skin nice and soft for us guys and all, right? So, but that's what it is. If it's dry, that's basically what spongy bone looks like. Okay, and feels like too. Okay, that's what's happening there. In non-long bones, for instance, in the skull, you're going to have compact bone on either side, and in the middle, sandwiched in between them, is going to be spongy bone. So it's a different setup over there. Okay. All right. So bone marrow. All right. Red bone marrow is in children and adults. All right. This is the site of hematopoiesis. Okay. We have red bone marrow too, adults do, it's just not in the long bones though, okay? So hematopoiesis, hemato meaning blood, poiesis meaning synthesis of, okay? In adults, we have yellow bone marrow in our long bones, and it's storing all our energy, all our fat there, adipose. So we have this hematopoiesis, right? Blood formation. Where does it occur? Well, it depends on what age you're talking about. If you're dealing with an embryo or fetus because the bones haven't really formed yet, well, it's going to all take place in the spleen and the liver. But in a child, the hematopoiesis is going to occur in the long bones, mostly in the legs. The femur and tibia are the ideal places, but they also happen in the fibula and also in the arms too. But we're looking at the femur and tibia as the main ones. So that's where blood formation is made. Adults, it gets a little bit complicated, but it makes total sense. The primary site that hematopoiesis takes place is going to be in basically our trunk and head, our skull and our backbone, ribs and pelvis too. Okay? Not the long bones. The long bones are loaded with yellow bone marrow. So in adults, you and I, it's in our skull and our backbone, ribs and pelvis. Now here's where the problem happens. Well, not really a problem. This is how your body adapts. Red blood cells, they can't reproduce. The reason why they can't reproduce is because they're missing something. What are red blood cells missing? Nucleus, right? If they go through mitosis, they can't go through mitosis because the mitosis is splitting up the nucleus. They don't have a nucleus there. So therefore, red blood cells only last for 120 days. 4 months, that's it. Then they die. We use this stuff. We use the amino acids, to make more proteins. We use the iron to make more red blood cells and so forth. But they can't reproduce on themselves. So here's the issue. And I'm just giving you numbers. If we lose 10,000 red blood cells because it's their time to die, we better be making 10,000 red blood cells to replace those. Right? It has to be, the number being lost has to equal the number being synthesized. Has to be. That's the system. If we lose 10,000 red blood cells and we are only making 2,000, geez, that's called anemia. Does that make sense? Or if my body is used to making 10,000, but we are losing 100,000, but we can only make 10,000, that's another form of anemia. When we get into hematology, we'll be talking about that. It has to equal. The amount being made has to be the amount that we lose. If they're out of sync, we got diseases going on. So for instance, our primary site to making red blood cells is going to be our skull and vertebrae. Well, what if we are losing them? Maybe, Dr. I have cancer, and my cancer is using up a lot of red blood cells. So now, I got to make more, a lot more. Well, I can't. The factories can only go as fast as they could possibly go. That's it. So it sends a message to the brain, say, hey, brain, we're losing a lot of red blood cells. We got to get more red blood cells. The brain says, you know what? That's a wonderful idea. We have some old factories that haven't been in use for 20-odd years. They're in the leg bones. The factories are there. We just got to get the cobwebs off. And guess what? If the primary source can't keep up with it, then what's going to happen is the secondary source is going to kick in. Now, 20 years they haven't been kicking in. So what will happen is now your bones are going to be getting active that they weren't used to before, and that's going to cause bone pain. So yes, people with cancer or people with losing or they can't keep up with this, they're going to get leg pain. Now, I don't want people to think that leg pain is, I got leg pain, I must have cancer. No. There's other reasons for that. You got to see other red flags of cancer to put that all together. All right? Or, if you have, let's say, a 12-year-old daughter and she has leg pain, that doesn't mean she has cancer. It's just she's going through puberty. So she's getting, this is probably what's happening, is all this bone growth going on. Much more fast than ever before. So you have to think, you got to put the whole picture together. And if the legs can't keep up with it, then it's the brain says, you know what, we got to go really back and we got to kick in the spleen and the liver because we got to get more of them out. Okay? So does that make sense? Right? Putting this all together? Okay. And this picture here is kind of showing you in red where those sites are, at least on an adult. You can visualize that. Okay? All right, just a fast overview of the synovial joint. Okay? Basically, we have a synovial cavity that's in here, and there is also going to be synovial fluid there. We also have, if this is going to be a joint over here, we have articular cartilage on the end bones, what I'm putting here in green. That's articular cartilage. See, what's nice about cartilage is it has no blood vessels. Well, that's not nice, but it has no nerves. So if this is my femur and that's my tibia, all that pressure of my weight is compressing that cartilage, and my cartilage doesn't feel any pain because there's no nerves there. So there's no problem. I can walk and walk. There's no problem. However, if I use my legs a lot throughout life, what will happen is those cartilage areas, and this is all hyaline cartilage, this articular cartilage, will start wearing down. And what will happen is you're going to have exposed areas. You're going to have exposed areas that might have some cartilage there, and there might not. So now you have areas of bone to bone happening, and they start riding on each other. Well, bone has nerves in it. And when you have bone to bone, that's going to start hurting. What disease are we talking about? At this point that we're doing, yes, it's arthritis, but the proper word is osteoarthritis because there's a lot of different forms of arthritis, and we'll talk about those. But you're right on the same track. That's good. I got you all. Everyone's on the same page with this. Okay? So, again, if you know the normal, if you know that there's cartilage there, what if we remove it? You got a disease. When you have too much of it, you got a disease. That's what's happening. So, the articular cartilage over here, all right? And that's what's going on. Now, the synovial fluid, see what happens is when you have cartilage to cartilage, and you have rubbing going on over there, it's going to produce a lot of friction there and heat. So the synovial fluid in there is going to relieve some of that friction, which means it's going to relieve some of the heat. So that's why we have synovial fluid there. One of the reasons.